Hi everyone, and welcome to Nairita's Talk, dedicated platform to help we all find the right insights and the right information in the beauty and aesthetic world. Bringing education, sharing the latest technology, and introducing you to the best doctors. Today, we're very fortunate to have Doctor Firas Hamdan from Highness Clinic to give his fruitful insights in this field. Hi, Doctor.
Hello, Nairita. Thank you for having me on your show.
Thank you for accepting my invitation.
All right, very good.
Tell us more about Dr. Firas Hamdan.
Dr. Firas Hamdan is a graduate of the American University of Beirut Medical School, and from there straight to the US, where we passed through 3 universities to do my training. Washington, D.C. as Georgetown, and then University of Tennessee in Memphis, Tennessee, to do head and neck surgery and facial plastics, and from there on to University of Florida to do a full body plastic surgery fellowship of 4 years. So a total training of 10 years, and practiced in Florida for another 10 years till 2006, and then we moved back to the Middle East. Unfortunately, we could not start in Lebanon. We started in Dubai, and now we have clinics in Dubai and in Beirut, of course, the main clinic, and we're branching out.
Today we'll be covering about the high definition in body sculpting.
Yes.
And this is what it's known as surgical body building.
Yes, it's like a smaller, fun name to call it. So for people who've been to the gym and cannot achieve results. They've been stable weight, stable exercise, and
so
they cannot.
I would love to know more about this.
So, you know, it is basically a body contouring for fit people. You know, people who have no weight problem, who have no obesity issues, whose weight is not fluctuating, people who are motivated, they go to the gym on a regular basis, they don't have to be on a day-to-day basis, and they would like to show some definition of their, you know, performance. You know, they're eating healthy, they're living healthy, and, you know, they're going to do gym and exercises. For men, they would like to show their abs, maybe their biceps, triceps. For women, they would like to show the, you know, the V line along the bikini line, and some definition. We don't like over-defining the ladies. So people like that are ideal. You know, they had not had fluctuation in weight, so their skin is firm. And also, they are motivated to continue because we give them the shape, and they continue the work. You know, it's not only us. It's like everything in plastic surgery.
Is it for everybody?
It is for everybody who is first, as we said, willing to do it. It's not for people who had massive weight loss, who were obese. It's not for ladies who had, like, you know, babies and they have loose skin in the lower abdomen. And it's not for people who are overweight and they want to reduce their weight. Okay, so
that's the normal.
That's you know, that's normal. You know, taking care of extra skin or just extra fat is either body sculpting, liposuction, or in combination with tummy tuck or breast lifting or whatever it is, to cut extra skin and reform them. And then, you know, their second step will be the bodybuilding or the sculpting. So high definition is, first you have to be good in sculpting or on liposuction, and then you go to extra level with extra training and using extra tools to get to that level.
What is the duration of the surgery?
It depends on the areas. You know, most men are looking for their six-packs. Yes. But, you know, we cannot give somebody six-packs who looks great in the front, and then when he turns to the sideways, they have like love handles or, you know, breast, you know, that's hanging down like a male breast. So usually it's one area, we call it the love handles and the six-packs, so they will have the nice obliques and the abdominal muscles showing. We can combine it with back to give them the V from the back, to give them the, you know, the torso and the trapezius showing like that. And of course, if they have a muscular chest.
So basically it's a 360 degree.
It could be 360, and, you know, each area will need about an hour. Okay. So, you know, if we're doing 2 areas, you know, within 2 hours we'll be done. But if we're adding the back and the chest, we're talking about 3 to 4 hours. And we're not liposuctioning, okay? So we are defining the muscles. We follow and we call it 4D sometimes because 3D is the shape of 3 dimensions, but also we ask them to do motions, you know, contract their abs, you know, standing sideways, and we draw their muscles in dynamic. So we call the 4D high definition sometimes.
Does it include implants or just your muscles?
No, there are implants, that are somewhat available in the Middle East, but there are implants that could be put to give the look of six packs. But this is not this is not an implant procedure. What we're talking about is using your own fat and giving shadows between the layers of the fat and the muscles and redefining your original muscle sculpture without the implant. Sometimes what we do to promote or to enhance an area, we move fat from one area to another. So in some patients, the sum could be zero fat taken out because we remove from areas, we add to other areas, and we worked for 4 hours and there's no fat taken out. So, and that's why we call it body sculpting rather than high definition liposuction, which is, it could be like that if we are removing fat.
And what are the side effects if we want to generalize?
Side effects is like side effects is like any surgical procedure.
Yes.
Some doctors do it under general anesthesia, some doctors do it under epidural anesthesia, some doctors do it under local anesthesia with some sedation to relax the patient. And it depends which way we are doing, where. It depends on who is with us, anesthesia team, and they, what's their preference. Because if somebody cannot do epidural, cannot do sedation, we will not offer to the patient. Otherwise, it will be a miserable thing. So the side effects. So if there's a side effect, like any procedure, whether you're removing a toenail or extracting tooth, there's sometimes could be bleeding, could be infection, could be pain. So these are regular.
Side effects.
So these are the regular we're not going to talk about. Common side effects. This is body sculpting. We are thinning the skin so much to stick to the muscles, okay? And we have in the same area, usually after liposuction, we give a compression to stick, for the skin to stick. But here in the same area, we have areas higher and areas lower. So we get a drain to suck all the fluid out to show like a vacuum wrap, when you have something you want to freeze and you vacuum it and it goes and takes the shape. And this is, we put vacuum out to suck out all the procedure, right? In the procedure to stay with us 5 days after. Oh, okay. So yeah, a regular liposuction, we should not use drains. If we have a complication or a seroma, collection of fluid under the body, it used to be considered complication. In high definition body sculpting, it's normal to put this. And if we don't do it, sometimes we collect some fluid. So it's a minor complication, but it doesn't need surgical intervention. God forbid, major, problem could be how well the doctor is trained. You hear disasters in liposuction, skin necrosis. They went under the muscle and perforated the intestine or something like this. In the chest, sometimes you can have, God forbid, this happens, the doctor needs to know how to take care of it. So this is also comes in where how experienced is the doctor and how many he has done, and he has, so these are the big complications that we should not have. And if we do get them, we should take care of them either by right away or, send them to a hospital that would take care of them.
So this was my second question. If you face a complication, during or post-surgery, how do you handle it?
I take it as a person and as a doctor. If we cannot take care of the complication of the procedure we're doing, I believe we should not be doing that procedure, okay? Unless, yes, not to risk it, because we have to take care of the patient. It's like jumping off the parachute, and if you don't have the first parachute, you should have the second one, okay? So we should have always something happens. What is the backup plan? Sometimes, for example, we're doing eye procedure, and God forbid we have a problem. Our backup plan is to have an eye doctor on standby, or, we can get them by phone. Or, for me to be able to take care of it until I get the adequate help. So this is where the doctor's experience come in. And if it feels like there's something that's maybe risky, we should not be doing that procedure. I would advise anybody or any doctor that will be doing it, don't do a full body first. Do first the abdomen and add the flanks, and then go to the chest and the back. So it comes with experience also. Of course.
Doctor, there are many plastic surgeons nowadays, and I can hear a lot of frustrations and confusions from people asking me, how can we get or how can we find the right doctors? What is your advice on this?
The advice is, one, to do your research, as patient, and it's not only what you see on Instagram or on Snapchat or on social media, marketing, because it could be a false positive.
Yes.
It could be a, wow, it looks very good, his before after on the table are wow, but you need to see 6 months down the line, 1 year down the line, what's going on. So this is number one, to find the right doctor. The right training is, of course, of utmost importance. Safety within the clinic or within the hospital is also good. So these are the basics. Now, even if I consider myself a good or average doctor, or maybe I'm the best in one thing, I'm not the best in everything. So it also depends, somebody wants eye surgery, breast surgery, body surgery. So it depends on what is the specific need. And it is well known among ourselves as your colleagues, plastic surgeons. I send a breast reduction to the people who do it because I don't do breast reduction. I did not train in it. I'm trained in lifting, in augmentation, and fat transfer to the breast. But if a lady comes in for heavyweight breast reduction, she has back pain, I don't do it. My training in the US was purely aesthetic, cosmetic, so we did not do those. Those are covered by insurance in the US, so they didn't come. I've trained on it, but I don't do them on a regular basis, so why do it if I'm not the best in it, okay? So this is where the doctor has to be honest with the patient, but the patient has to do their research. Many times they come to me, oh, doctor, you're traveling all the time, we cannot find you, so we went to this doctor, and then he did the procedure, and we didn't like the results, so we went to that doctor, and then he did the correction, and it got worse, and we went to this doctor. So when they come to me after 4 doctors, and they don't have to be plastic surgeons, the people who've been to, then it's much harder to fix and to show them the result that we usually show. So from a virgin case, no doctor has touched it. This is where you can do your best. At the beginning, the first time, have it right, whether it's a nose, the most important, If it doesn't work from the first time, the second time is harder. The third time is much harder. Fourth time is, I send them to the doctor who do it. We have a doctor in Beirut who does it all the time. We have a doctor in Dubai who does it all the time. I would not go into that. But I do revisions of liposuction 4 or 5 times because that's where I have patience to spend time with it, So it depends.
What are the common errors and mistakes you face nowadays with your patients?
And
like the common, when some people are too extremists.
There's two commons. When the doctor promises too much, and the patient has very high expectations, and the doctor says, hey, don't worry, we can do it, and they go in and they come out frustrated, not having the result. That's a very common things we get. And I asked him, did you ask the doctor that you really wanted to be like this? And he said yes, he can do it. And he used the same machines that you use. I said okay, it's fine, but it's between the patient and the doctor then. What was the understanding? The second most common is where the patient wants something in their mind, and that's completely different than their actual physique. For example. So we can take maybe Michael Jackson as an example. He wanted to be looking not dark, and complete transformation. And he ended up by losing his nose. He was with a mask because he had necrosis on the tip of his nose. He had implants there, and he was still not satisfied. So this is like a patient, and when we have these patients, it's a red flag.
So if you have this kind of patients, probably they can be stubborn and they're not accepting your opinion. How do you deal with them?
Okay, so when we have patients like this, and we do get them in my clinic, and fortunately or unfortunately, some of them are known to me, like friends of friends or friends of family members, or even family members, and they want me to do something. Of course, I will not do it because it's not gonna look good for them, or it's unfeasible surgically. Sometimes I try to appease them by doing something that will not harm them. Let's say they want something
to find the common ground,
a filler of some sort. I say, well, I'll do this, but I will not, add more to your lips. Or, every woman in the world wants this look here, or now the ponytail, or whatever it is. And we tell them what will like Botox will do, by adjusting the muscles and putting their brow in the right position. What would a thread lifting do, which is very minimal in this area? What would filler do?
Altera now, there is also a
Yes,
new
what would
technique.
machines do? Of course, Altera, Thermage, and other machines. And finally, what would surgery do? And still with surgery, some people even want more. So this is where we draw the limit, because they have a fashionista or a blogger.
Why do you think people want more? What's the psychology behind it?
Because probably now, the Kardashians are on. Okay, nobody mentioned and talked about BBL before the Kardashians. Good. Now, the Kardashian, we used to be with Kim, now we have Kylie. And, they both have that look. And, they show me, we want this open eyes. We are bombarded on social media by very well done, photoshopped, photo shoots, professional makeup models. The common lady, even with all my respect, you're coming in, you do your makeup, you adjust a little bit, and you come here. You don't have 5 makeup artists and 2 hair brushers and 6 professional photographers following you and posting 5 posts on Instagram daily. That's what they're seeing, and they think this is normal life. But life is not that like that. Even if we see them in life, whether we were in Los Angeles at a restaurant, they don't look the same. And there is...
They are the victims of social media.
No, they become obsessed. So they become obsessed with a look in their mind. And, I have in my clinic somebody like this. She used to have 10,000 followers. Now she has 200,000 followers. And she becomes more obsessed because the lady that she's looking at has 1 million. And she looks like that. And then finally
so it's
she
the
becomes...
satisfaction. They don't feel this
They're thinking their look is what's bringing their success, rather than themselves is bringing the success, and they have to look good. So it's that, follow your tail question. Who's gonna be better, and how look I can good? Of course, we want to look younger. We want to look fresh. We don't want to look tired. That's normal.
So what's your advice?
Advice is be yourself. Accept what, use Photoshop if that helps your problem, because sometimes physically, anatomically, and chemically, or with machines, we cannot achieve what you want. There's bone structures, there are soft tissue structures, and then there is, ethnicity that is plays a role. Some people are traveling to Korea to get the cat eyes. And when we went to Korea, with a company that trains for threads and all this, and we were talking to the lead plastic surgeon there, Dr. Kim, he goes, only Middle East people want cat eyes. What's wrong with the Middle East? You love cats? I said, no, they want to look, because they look at pictures from LG phones and, Samsung and all those.
Probably the trend also.
Yes.
They like to follow trends.
Well, it's to follow trends, but to have a cat eye for a woman, meaning cutting from here and suspending it up, and it's long term, it doesn't look good. We've seen them on social media, the people who've done that, the cat woman and whatever it is. So it's not an easy procedure, and it's not very feasible.
Doctor, what do you think the trends in plastic surgery for 2020? Where are we heading?
In general health, antioxidants, and staying healthy, and now keto is back in, detox, intermittent fasting, and all of that. So that's the health-wise. So has somebody, staying away from smoking, except in the Middle East maybe, because they don't consider shisha smoking, but it's a major culprit.
Of course. Probably worse than cigarettes.
Exactly. So, for them, we don't smoke, but we do 5 shishas per night. It's like, no, that's smoking. That's that. And then the trend is to be slim, but not too thin. Even for bodybuilding is to be good-looking, muscular, but not overcorrected. So overcorrection is we're shying away from it, and look yourself natural and soft beauty rather than very sharp beauty. We had everybody was obsessed with Texas 2 years ago, and Texas this and Texas that, which means what? Not everybody looks good with Texas. If somebody is fat and you give Texas on their face, they look 2 different people. So it's the trend is it goes up and down according to social media, but then the good things stay for a long time. It's nice to have a nice jawline. because what people don't like with their jawline is when their jowl drops. So it's not straight. By doing it straight, it looks younger. It doesn't have to be Texas, you know.
Probably the name, just the name,
The
and
name,
people like
well,
to
the
follow
name,
names.
the name came out, and you were with another good doctor friend in Kuwait, where, you know, somebody's asking us for the straight line, and, you know, we were joking. I said, so you wanted like a Texas cowboy? Because, you know, the Marlboro men and all those people in Texas with the big boots and the big hats have very chiseled face. And this is where the name Texas came from. Nobody in Texas has a straight line.
Yeah.
You
It's
know,
only
if
the
you-
Marlboro ones.
Yes.
This is true. But the thing is, what I see even as a common mistake, what's happening nowadays, women are trying to focus on the jawline, where men are also trying to just focus on the cheeks. So I can see the complete transformations between the women are like looking like masculine, and the male are looking more
Feminine, yes.
feminine. So what do you think about this
Well,
common
you know,
mistake?
before I touch any woman, she has to sit in front of the mirror. And we have to evaluate what they want, and, you know, we can achieve a little bit of what they want, and sometimes we don't. Now, before, you know, let's talk about our culture here. You know, before they will tell you, Haifa Wahbi, this, that, and now 2 years later, now they're talking Nadine James, Nadine James, Nadine James, that has a very straight line, and even, you know, with all my respect to Nadine, which we know her, she overdid it sometimes, and then she had to go back and become milder, you know. Because she followed the trend. You know, it's like the joke of Jiha in Lebanon.
Yes,
he
yes.
tells the joke and then he follows it.
Yes,
So this is where, you know, the thing is. The
Or maybe
men,
it's addiction. Do you think it's addiction? I
It's
feel
not
like
addiction,
sometimes the
yeah,
people,
you know, it's like-
when they start doing this kind of procedure, they become addicted.
yeah, well, it's addiction. It's looking better and better and better until you cross that line, and then, oh my God, why are you so like that? And then you tone back, and they say, I don't want to do anything, and then you go backwards. And then you realize that being in the middle is okay. So yes, there's an addiction. Now, true addictions are a problem. You know, some people are truly addicted to surgeries.
Psychological issues.
Yes, surgeries, you know, they don't mind scars. Some people are truly addicted to fillers, you know, some people are truly addicted to machines. And, you know, moderation is always good.
Yes. And I believe sometimes the perfection is imperfection. What do you think?
I tell people the enemy of good is perfect. Because when you are almost level and you say, can I do one more thing that
So
will
that's-
fix this? And then if we cross that line and we never can come back, it's a problem.
Yes.
And sometimes we fall for it as doctors. You know, we think we can do, but, you know, Nairita at age 20 is different than her at age 30,
Of
40,
course.
50, even if you have the same weight.
Of course.
Even if you have the same height, you know, there's changes in your bone structure, there's changes in the quality of your
Features.
skin.
Yes.
That's why Ultera, for example, to work under the skin to stimulate things, you know, sometimes putting fillers to replace bone, not all fillers are to replace soft tissue.
Yes.
Sometimes we use, you know, a product called Lift, you know, to lift the bone and lift the tissue to where they belong
It's
rather than
correction.
yeah.
Aesthetics treatment.
rather than just
correction. It's not-
harmonization.
yeah.
You know, we use the word
Yes.
harmonization in training a lot. Just your face to look harmonious rather than everybody coming like a moon face, you know.
Yes.
That was a trend maybe 5 years ago.
Yeah. Thank you so much, Doctor,
Well,
for
it's
your
been a pleasure.
fruitful insights.
Thank
I
you.
really enjoyed the interview with you, and thank you so much for accepting this interview.
Our pleasure, and we look forward for more.
Hopefully, I'm going to come and visit you in your clinic and do live demos.
Okay, that'd be great.